It's really important for me to step into Montgomery County and be able to share this day because it's obvious that incredibly wonderfully good things are going on here with respect to elder abuse. I'm sad to say that that's not true everywhere else in the country. It just isn't. And I sometimes find myself feeling bleak and sad about the lack of progress that we're making nationally. And I'll touch a little bit on that. But I'm inspired by what you've heard today and all that you're doing. It really is very, very impressive to me. And I look forward to the opportunity to share that with my colleagues on the national level. I'm going to focus, as I said, a fair amount of my attention on adult protective services. Mario and his colleagues here in Montgomery County they have colleagues everywhere else in the country who are working incredibly hard, toiling under very difficult circumstances, and fortunately, in many cases, also having the array of partners that you have here in Montgomery County. But I focus on adult protective services for this reason, because it's the common denominator in every community in America, in every state. Every state has an adult protective services program created by statute to receive reports of abuse, neglect, and exploitation of older persons, and in the vast majority of states, of younger persons with disabilities who are unable to protect their own interests. Just as we would never begin any discussion of child abuse without starting with the established protective services systems for children, CPS, Child Protective Services, we cannot really begin to talk about addressing elder abuse and abuse of younger adults with disabilities without starting with the established state and local protective service systems, adult protective services. APS is central in any community to any meaningful response to elder abuse at the state and community levels. And that's why I will talk more about APS probably than I do anything else. I gotta get this right. Elder abuse is a problem, we all know this, that causes untold pain for victims and those who care about them. It also costs billions of dollars that are borne by public programs, businesses, families, and individuals. So the cost is not just to individuals, the cost is very much to society. There we go, I'm getting it right. Elder abuse, which includes physical, sexual, and psychological abuse, as well as neglect and financial exploitation in any setting, affects more than 5 million Americans every year. 5 million Americans are victims of elder abuse in this country. What's important about that is to put it in context. There are about 1.25 million child abuse victims each year and 2.3 million domestic violence victims who combined receive, to support and address their issues, receive billions of dollars in federal funding. Elder abuse dwarfs each of the other two categories I've mentioned. That's a very important point. Why? Because they're so vulnerable, and also because there's so many of them. And there will be many more, as we all know, in the years ahead. It is estimated, and Uma mentioned this a little while ago, that for every one case of elder abuse that comes to the attention of authorities, 24 cases go unreported or undetected. 1 out of every 24. That's extraordinary. And when it comes to financial exploitation, the rates are even higher. The disparity between what's reported or comes to the attention of authorities and what actually takes place is even greater. A bit about financial exploitation. It may affect an estimated 20 to 30% of older adults are victimized by financial exploitation of one kind or another. And the estimates for how much money is lost annually to financial exploitation of the elderly range from $2.9 billion to $36 billion per year. Why that gap in the estimate? The reason for that is because the first figure came out in 2011 from a MetLife study that only looked at what they could find in newspapers about elder abuse. They only based it on newspaper reporting of convictions and indictments. The TrueLink report that came out last year looked much deeper into much more reliable databases, and that's why their figure is at $36 billion. Either figure is vast. but we suspect it's far closer to that $36 billion per year. You know, many of you have heard the Willie Sutton line, which is when he was asked why he robbed banks many years ago, the answer was, well, that's where the money is. So why do people exploit older people? Because that's where the money is in many cases. And so it's no surprise that the sheer numbers and the combined assets of the older population make them incredibly vulnerable to financial exploitation. Financial exploitation is expensive. Victims and their families lose assets that took the older person a lifetime of hard work to build. These losses directly affect their health and well-being and result in invisible increased cost to the Medicare program, which we can scarcely accept. Secondly, financial institutions lose billions in assets as the money stolen is usually snorted, smoked, drunk, or gambled away in all too many cases. 3, the taxpayer loses as well. One recent study found that 9% of financial abuse victims had to go on Medicaid as a direct result of losing their own assets, having them stolen. That drives up costs to states, to local government, and to the federal government in Medicaid expenditures. And since older elder abuse victims are 4 times more likely to enter nursing homes than other seniors because of their being victimized, this also translates into huge but hidden costs to Medicaid. We've talked at the national level for years and years and years about the problem of elder abuse. We have a long congressional history of trying to tackle this problem. I'm not going to go through all my slides, but in 1950, the Health and Education and Welfare Department, now HHS, funded some demonstration projects to create protective service units across the country. We sort of think of that as the beginning of addressing elder abuse. Then we didn't do much else for many, many years until the late 1970s when Congress began having hearings, hearing after hearing after hearing about the topic of elder abuse. We did do a couple of things along the way. In 1987, Congress decided to put an elder abuse prevention program into the Older Americans Act, which funds the Area Agency on Aging and other folks. That was a big deal. And Congress in 1992, when I was working there, appropriated $5 million for the entire nation to prevent elder abuse. Now in 2015, which is however many years later that is, what is that, 22 years later or something? Guess how much money is still in that pot of money going out to states? $5 million. It has not gone up 1 nickel since 1992. And that's divided among 50 states, 7 territories in the District of Columbia, and all the area agencies on aging. You can do the math to figure out how far that goes. Fast forwarding, Congress began in earnest doing hearings in 2003, leading to the introduction of the Elder Justice Act. The Elder Justice Act was introduced in 4 consecutive Congresses, covering 8 years of not passing, and then finally and I'm going to skip ahead to the Elder Justice Act, finally in 2010, Congress passed and the President signed into law the Elder Justice Act, the nation's first major legislation addressing elder abuse as part of the Affordable Care Act. That was a big deal. That was a big deal. It has a lot of good things in it for communities and states. Unfortunately, all the things that would have benefited law enforcement were stripped out of there because of jurisdictional disputes, and we still hope to get those back in there someday. They were stripped out, but at least things like forensic centers and so on and so forth, money for the Ombudsman program, that was all authorized in the Elder Justice Act. That was good. It was really good for adult protective services. It would have provided money to states to support adult protective services to the tune of $100 million per year, a nice amount of money if it were to flow out there. But unfortunately, despite that great news, we got close, but no cigar. And why is that? Because it was made law in 2010. No money was appropriated in 2011, no money in 2012, no money in 2013, no money in 2014, not 1 single penny for the Elder Justice Act. Not 1 penny, not 1 penny. Fortunately, in 2015, we did finally get our first little bit of money, $4 million. $4 million, none of which will go out to states to support adult protective services because there's so little, they can't do it. So it will at least be used to help build at the federal level some activities in support of adult protective services. So that's the bad news. That's hard to see, but I'm just going to describe it to you. It's a little bit of a dated chart, but the red is the amount of money that goes into child abuse. The blue or purple is the amount of money that goes into domestic abuse from the federal government. Out of all the federal money going into addressing abuse of one kind or another, and that little sliver of yellow is the proportion that's going to elder abuse. And that is actually, it's now about somewhere around $215 million nationwide. $5 million comes out of the Older Americans Act that I already mentioned, and the rest of it comes out of the Social Services Block Grant, and I'll speak to that in a moment. Reality check. Nobody would argue that child abuse or domestic violence gets enough money to support their needs and address the problem. There's not enough money for them. But what we can say with clarity is there's sure not enough going to addressing elder abuse on a national level. There just isn't. And this is important. Money talks. Money talks. What is rarely acknowledged is that the federal investments in addressing both child abuse and domestic violence has resulted in significantly reducing the incident rates of both. The rates of child abuse and domestic violence are going down. Yes, federal programs and support can and do work, in these cases saving lives and the well-being of countless women and children. We need to do something like that for older people as well. They deserve it, the needs are great, and we've got to get there, and we're not there. And I'm going to skip forward and just say, despite the national funding picture, there is a lot of good work going on in this country addressing elder abuse, and you see it right here in Montgomery County. We need to do what Montgomery County is doing in every other county and city in America. And to the extent that you can't do more because you don't have the resources, at least that collective good work may trickle upwards as opposed to trickle down and help our policymakers at the national level, particularly in the Congress, realize that this is something that's worth doing. It's worth doing, it's worth spending a few dollars on. I won't go through all the great stuff you're doing here in Montgomery because you know it, but there are some good things going on the national level. They're small scale, but they're important. Let me just touch on a couple of them. We have an Assistant Secretary for Aging who runs what used to be called the Administration on Aging, who who stated publicly and over and over and over again, I consider elder abuse to be an outrage against humanity. And because of her, we got the president to put at least $10 million into his budget for the Elder Justice Act, and Congress gave us 4 of that. Step in the right direction. Under her leadership, we have the first ever, using her discretion, National Adult Protective Services Resource Center. We have a national center on elder abuse. We have more and more attention to World Abuse Awareness Day. She was able to get some funding to do some demonstration projects to test ideas about how we deal with elder abuse. We're learning some other good, we're doing some other good things. There's some remarkable research going on right now about what cognitive impairment does and how it relates to financial impairment. As Dr. Daniel Marston, who's a lawyer and a neuropsychologist at the University of Alabama, Birmingham, in his laboratory, what he's demonstrating is that the canary in the mine for dementia is how one handles their financial well-being. That he believes, and he's getting incredible attention, that people that we think are entirely, perfectly, cognitively aware and together, the hint that they may not be is they start making bad decisions about their money. They buy into the grandma scam, which would be out of character for them, but otherwise they're perfectly intact. It's a sign that there may be early stages in some cases of dementia, but way earlier than anybody else would see. There's more and more efforts being done in states to put a temporary hold on dispensing clients' funds from banks if there's reason to believe fraud is present. And I'm pleased to say that on Monday at the World Elder Abuse Awareness Day event in Washington, D.C., NAPSA will unveil a document to be used by adult protective services programs all over the country to get banks to give up the bank records of people who are victims of elder abuse, because APS needs them to work with law enforcement and others. And we believe And we believe this will help comply with federal laws around banking that require privacy, that this will get us around it. That'll be unveiled and sent out to APS programs all over the country. My last thing that I'm going to touch on today before I close is something that's not quite as good, and that is the social services block grant. I'm going to guess nobody in this room except for a very small number of people are aware of the social services block grant. It is the single most important source of human service funding in America, presently at about $1.7 billion. It is money that is very flexible for states to use for human services. Why I'm mentioning it, because you saw my pie chart earlier that has about $215 million going to elder abuse, or APS. 203 million of that is out of the social services block grant. 36 states, including Maryland, choose, it's their choice, they choose to use their SSBG dollars for adult protective services. Most states use it for child protective services, they use it for mental health services, they use it for all kinds of things for people of different needs. But it is the lifeblood of adult protective service funding in America in 36 states. Several states entirely fund their APS programs out of SSBG funding. Maryland spent in FY 2012 $3.477 million in their SSBG money on adult protective services. That is a substantial portion of Maryland's funding for APS. I raise this because with our current Congress, SSBG is severely threatened. It is severely threatened. Already budget proposals have been put forward by the chairman of the House Budget Committee over the last 2 budget cycles to eliminate SSBG. The elimination of SSBG would wipe out APS programs in many states, just literally wipe it out. I asked Maryland, for example, if you lost $3.477 million because it was eliminated, could you come up with that to replace it? Probably not, or at least at great pain. Here we are trying to get new money that's badly needed under the Elder Justice Act, when in reality, we have the threat of losing what's out there in many states. We need severe advocacy, real advocacy, and that starts with people understanding that SSBG is the lifeblood of adult protective services. So my concluding thoughts are child abuse and DV rates, domestic violence rates, are dropping. These arenas of abuse have received significant federal and state funding. We know elder abuse cases are increasing. We know too few of them are investigated or brought to the attention of authorities, if for no other reason just driven by the demographics of an aging society. We also know that when Congress provides $5 million for preventing elder abuse in 1992, and it's the same amount of money in 2015, we're not doing enough advocacy. And that begins here at home. That begins here in Montgomery County, begins here in Maryland, along with all other states. And so all I think we can say to you is, please, all of you, focusing on Montgomery County is really important, but we also need to focus on the bigger picture nationwide. Elder abuse victims are in every community in America, and we're going to have to step up to the plate and convince our leaders, not your leaders in Montgomery County, they're doing the job, but the leaders elsewhere and certainly nationally, that we have a serious problem on our hands. It's one that's growing, and we haven't been serious about it. And the purpose of World Elder Abuse Awareness Day is to do just that. We need many more Rhoda Baruchas. She is an incredibly brave woman. We need more people like her who have been victimized, who are embarrassed, but have to step forward because they are the face of this problem that too few people take seriously. I know you do, and I am proud of you for doing that. We think you're wonderful doing that, but we need far more of your friends, neighbors, colleagues, family members, wherever they live in America, to take this problem seriously. Thank you all very much.